points. Why would you come out of retirement from working in the NHS only to have your wages slashed by 50%?
Yeah, I must admit, I did not know that that was the case.
That's absolutely ridiculous. I think the problem in this country is, part of it is, there isn't enough incentive for people to actually want to work in the NHS. That's why I do feel as though nurses should be paid more fairly. Don't think we should be importing nurses in from overseas. Instead, we actually need to face our problems instead of trying to run away from them, and actually make these sorts of jobs attractive to people in this country. And particularly when it comes to nurses and the debt that they have, or the need for them to go to university. Personally, for me, I don't really feel as though a nurse has to go to university to be able to qualify to be one. It's vocation. It's a vocation, so therefore the sort of training should be more vocational, you know, sort of like you would if you were an apprentice. So
yeah,
therefore
this
you get
is
paid.
something that you know, family members of mine, older family members of mine, have always been completely bemused about why nurses need to be university educated. It seems that for absolutely every job nowadays, you need to have had a degree, a long qualification. It all adds to the cost of living for people. And I do think people have been talking about how some young people simply won't be able to go to university or will drop out because of the cost of living. I don't understand how people are going to be able to afford their rent, their energy costs, on top of the student fees, on top of God knows what else. You can only get so much in a loan and as a grant. It's going to be really, really hard for students. I do wonder if that might make people reconsider. But in terms of the NHS fundamentally, we didn't really get onto that. I was hoping to speak to the doctor about the NHS as a big institution.
Yeah.
Do you think it fundamentally needs reform?
I do think it needs reform. I don't think it's competitive enough, and I think that's why a lot of people now are looking towards the private sector to sort of skip the queue in a way, or get paid their fair share, because, as that lady noted, nurses are actually paid more in the private sector. And look, I understand that the NHS isn't supposed to be a place where you make money, but it should be a place where you're serving the general public, but you also have a decent wage and don't necessarily have to go to food banks, for example. And I think that's really important. But generally, I think our politicians have been far too scared of actually addressing the problems within the NHS. The Tories have embraced really a socialist view of our healthcare system and how it should be run. Personally, for me, I would back sort of a partly state-subsidised insurance-based system.
Yes, like we see on the continent.
Yeah, like in Europe. And we praise all of these countries as sort of socialist utopias of equality, but many of these countries either don't have a minimum wage or their healthcare system is insurance-based, like in France.